Hello, and thank you for giving me a few minutes on your program to answer your question about the impact of hospice on survival. I'm sorry to hear about your aunt. The study you quoted in your question probably included patients who were admitted to hospice late in their disease trajectory. The studies actually indicate that early intervention with palliative care and hospice have a favorable impact on outcomes. There's a recent study in the New England Journal of Medicine that indicates that early palliative care intervention results in appropriate and beneficial treatments, increased quality of life, and may also lead to prolonged life and survival. The findings of the study are strong, and yet we as a medical community want to replicate the study. The earlier palliative care intervention would also be associated with earlier hospice enrollment once the patient seems to be entering the latter stage of their disease process. The favorable impact of hospice is related to some of the many benefits of hospice, like spiritual care, doctor and nursing care, home health aides, physical therapy, occupational therapy, dietary counseling, medications for symptom control, medical equipment, durable medical equipment, and also short-term care in a hospital or a skilled nursing facility is permitted for pain and symptom crisis management. So you see there are many benefits to hospice care that can improve quality of life and survival for the patient, especially if the patient is admitted early in the final stages of their disease. So hospice is actually very liable to ensure a patient's final days, weeks, and months are more satisfying and more in line with their goals of care. In fact, you might be interested to know that studies indicate that 7 of 10 people prefer dying at home, but 70% of these actually end up dying in a facility. Also, 80% of patients, as they near the end of life, want to avoid hospitalizations in ICU, but regrettably, statistics indicate that this is growing, not decreasing. And this is where hospice can help. Hospice care becomes the best fit when the goals of care and treatment preferences reflect a desire to stop aggressive measures, to avoid rehospitalizations, focus on high-quality days, aggressive symptom control, and increased services in the home. So you see, appropriate and early hospice enrollment will provide quality of life, help people achieve their goals, and may even improve longevity. Thank you for the opportunity of answering your questions. Hope to be able to visit with you again.